So I'm Dr. Bernie, and I'm a homeopathic practitioner. I have offices in Gilbert, Arizona. I treat globally, so we can see all of our patients online now virtually and mail you your medicines and discuss your case history and all that good stuff. Go to gilbertnaturalmedicine.com and read about everything that we do there. And also, please go to Arizona Academy for Natural Health.com and learn about our wonderful medical course in homeopathic medicine. It's a course that is inexpensive. Anybody can afford it. Trust me. You take it at your leisure. Go to Arizona Academy for Natural Health and read the syllabus because it has everything in it so that you can start practicing homeopathic medicine. And at the end of that course, when you pass all your tests, very simple, I will send you a certificate that you completed the course, and I will stay with you as a student and practitioner if you intend to treat others with homeopathic medicine. So I don't just say, here's the course, dump it on you after you pay for it, and that's the end of that. I actually stay with you and help you. If you have a patient, you're able to talk to me online, and I will help tell you what to do for that patient until you kind of catch on. You know, it's just like being a new driver. You have to get behind that wheel and put in enough hours so you're real familiar with the road and the road tricks. It's the same thing with a course. You know, you take a course in whatever, and you think you got it all, and you set out to practice what you learned, and suddenly you can't think of anything. Same thing with anything. So that's why I stay with you and I help you with your patients until you kind of catch on. Homeopathy is a lifelong study. So if you are a naturopath or a doctor of Western medicine and you think you're going to go into alternative medicine, you're going to study, you're going to work with homeopathy, you can't. You have to take homeopathy as a specialized course and learn it before you can honestly say that you know it. So I don't care what you do in life. Homeopathy is a specialty, just like a lot of other things are, like acupuncture or Chinese medicine. It's the same thing. It's a specialty. You have to go there. You have to learn that specialty before you can work with it. So, you know, if you have to go for brain surgery, you don't go to a carpenter, go to a brain surgeon. Same with homeopathy. Same with anything. You want your kitchen remodeled, you don't go to your gardener, right? I don't think so. You go to someone that does kitchen remodeling. Okay, you got the message. Let's talk about herpes. That's what I'm here for today. Herpes is it's an STD, just like, and you should know this already. You've been around the block a few times. That's why you're watching this video. Okay, STD, gonorrhea, syphilis, HPV, HSV, which is your herpes simplex and all that stuff. So we're going to talk about herpes because beside HPV, which is human papillomavirus, which are warts, and there's a gajillion different warts, you have to know which one means HPV and which ones are dangerous. So herpes is so common. So that, like as HPV, but we're going to concentrate on herpes because almost everybody has herpes. Even if you don't think you have herpes because you've never seen a breakout on your body, doesn't mean you don't have herpes. It means that you haven't been tested positive. So you think you're negative because you don't see it. Well, let me tell you something about herpes. It's tricky. It lays in your nervous system. Not a bunch of herpes pimples in your nervous system. Silly. It's the virus that lays in your nervous system dormant. Maybe you'll never have an outbreak. Maybe you'll never purge. Maybe you will. But that virus, and yes, it's a virus. Every STD is a virus. One of my specialties is working with viruses. I've done it for 20-something years. I've been in practice since 1994, and I learned in England. So I learned the real homeopathy, and all of my medicines are from Germany, France, and England. That's it, nothing from the USA. Why? Because we don't make anything that cures anything. in the USA, including your COVID vaccines, which I hope you're not taking. Okay, that's another day, another story. So when this herpes virus lays dormant in your nervous system, you want to be checked. You want to go to your doctor. Say, I want a herpes panel. I want you to take my blood and see if I'm positive or negative for herpes. And if you come back positive, but you've never seen an outbreak, well, you're kind of lucky, maybe 50% of 100%, but you're not real lucky, 100 out of 100, because you still have herpes. Doesn't mean you have to break out. But when you do have a purge, a breakout, you may see one or a whole bunch of little pimples. Now, it starts as a virus, and when it works its way through your system, the last place it goes is on the skin. It can't go any further than that, or it would be in the ethers. So if it lands on your skin, you know your herpes is it's active. It's active. And so the last place it shows up is on your skin. And how does it show up? It comes out of the blood system, goes into the skin as a pimple. So that's how you see what a herpes looks like. Go to your internet, guys. Go to Google. Google, what does a herpes look like? You'll see what I'm talking about. Venereal herpes. Let's talk about that. I don't know. It's all contagious. It's all contagious, whether it's on your lip or whether it's on your genitals. It's all highly, highly contagious. So if you don't get this fixed, guess what you're bringing home to your family? Ta-da! Or maybe somebody already in your family has herpes, but you don't know because they never purge or they don't tell you. It's something, it seems like everybody wants to keep quiet. Don't talk about it. We don't want to spread the news. It's not good news, but it's highly contagious news. So maybe that's another reason why you don't want to say anything to your spouse or your girlfriend or boyfriend or mom or dad or sister or brother or whatever. You don't want to talk about it. You want to keep it a secret. Well, you're not helping anybody. Go to the doctor. See if it's negative or positive. You're not only helping yourself, you need to think of the next guy, just like this COVID thing. You wear a mask, not just to protect you, to protect the next guy. So if you're going to sleep with somebody, let's be candid, and you're having intercourse and you're purging, shame on you. That is the most contagious part of herpes, is when you're purging. Here's what it feels like. To have a breakout, you'll first get a little stinging or a burning or an itch, and you don't know why. And all of a sudden, in a few days, bingo, you see a pimple. Well, hello, guess what that is? Unless it's a wart, it's herpes. And warts usually don't come one by one either. They're notorious. Again, we're not going there with this video. So if you have a breakout, you need to get fixed. Don't let anyone ever drink out of your glass or use your toothbrush or your washcloth or your shower puff or whatever you use in the shower. Don't let anyone kiss you during that time. And above all, if it's genital, don't sleep with anyone during a purge. Now, if you suddenly notice, or if you go to the doctor and you check out positive and you never saw a herpes breakout on your body, but you test positive, don't come home and blame somebody. Don't blame your husband or girlfriend or wife or sister or brother. Don't blame anybody. Check yourself out first. Who cares where you got the herpes? You could have come down the birth canal and contracted it from your mom, who never knew she had herpes, or maybe she did. And back in those days, maybe they didn't even talk about the flu. You think they're going to talk about herpes? Mm-mm. Don't be afraid of admitting that you have herpes because you're afraid to discuss it with your wife or husband or whatever. You know what, guys? They have a right to know, because then they could go be tested too. Don't expect Western medicine to cure herpes or any STD, especially syphilis, because they cannot. They might be able to shoot some medicine up in you or give you a pill. That's not going to cure it. There's only one way to cure herpes, and that's with homeopathy. My method. I treat like with like. I get my medicine for herpes from London, and it's wonderful. It's always fresh. It's always made for me. And they get it from the herpes virus, but all the poison, all the activity from that virus is taken out. So you don't get the active virus. You just get the placebo of the virus. So when you put it in your mouth, you take those drops, it connects with the brain because it's an energy medicine. It goes into the mucous membranes. The brain reads the medicine and starts curing you. Now, there's a protocol for herpes, and it's 3 months of medication. And if you're not cured in 3 months, because I'm going to send you out for another test, then you do another round, because I don't know how loaded your body is or how not loaded your body is. So you need to catch this as fast as you can. So if you've had it for a while and you've done nothing about it, don't blow it off, guys, because it's a nasty, nasty virus, especially when it appears on your lips and you think it's a cold sore. Back in the day, they said, "Oh, you have a cold sore on your lip, either upper or lower." Oh, well, that probably means you have a cold. Because back in the day, they didn't know beans about herpes. So they figured you have a cold sore. It represents a cold in your body. You know why? Because that starts the mucous membranes going crazy. And your nose will run, your eyes will tear. You might feel like you have a cold. It's not a cold, it's herpes. So if you have a cold sore, I don't care about having a cold. You have herpes. Ta-da! That's what it represents. So, got to fix this. You've got to get treated. And if you tell someone that you're sleeping with, or someone in your household, or something that you have herpes, and you're very close with them, they have to be treated. They have to be tested. They need to go for a blood test. And you don't want to say to your husband or wife or whatever, "Hey, do you have herpes?" You think they're going to admit it? Very few people will admit it because they're scared. So they're scared of being blamed for getting it from someone else, somewhere else. That's not the case, guys. So if you ask them point blank and they say no, go get tested anyway. Don't believe anybody. Trust no one. Not when it comes to an STD. Trust no one. Trust yourself. And you know what, guys? You are the most important thing in your life. I know your children are important and your husband or wife is important and your family is important, but the most important of all is you. And you need to take care of this body, this shell that houses everything about you, everything from good to bad. It's all in this body, this physical thing that's going to work every day and getting up and going to bed and taking care of everybody. Da, da, da. You are so important to you right now that if you can't care for you first, don't think you can care for anybody else, because you can't. So get checked out. At least do yourself that favor. At least see if you're negative, because if you are negative, that means you didn't get it from anybody. It doesn't occur. It's not around you. If you're positive, don't blame anybody. You could have got it from anywhere. Okay. So I want you to go once again to gilbertnaturalmedicine.com. I want you to look up what we do. I want you to give us a call and let me help you get rid of herpes, because no one else will. I'm Dr. Bernie. Thank you for listening. And next time, maybe we'll talk about HPV. One thing I have to tell you, if you don't cure your herpes, it is predisposed to strokes, heart disease, and many other illnesses later in life. If you don't cure HPV and you know you've got warts, now there's all different kind of warts, but we're not going to go there right now. Like I said, if you have HPV and it's been proven that you have HPV and you don't cure HPV, let me tell you what you're in for. You're in for cancer, because that's all it does is produce cancer in your body. So, hey, I would definitely go to the source. If you know someone that's had cancer, or if there's cancer in your family, Go back until you find somebody in your family that had warts. I guarantee you it's there. Don't be a carrier. I'm Dr. Bernie. Once again, I'll see you again. Hey, you know what? Life is just that simple.